So neonatal resuscitation. As an introduction, this is a very important topic from which many questions are asked. So you need to learn the key concepts in detail. Okay. The successful transition from the intrauterine to extrauterine life is dependent on significant physiological changes that occur at birth. And although most newborns successfully make this transition at delivery without requiring any special assistance, a small but significant number of newborns do require some form of assisted support or some kind of resuscitation in the delivery room. Okay. The order of priority of resuscitation in newborns is TABC. Okay, that is first comes temperature, then comes the respiration, that is the airway, then comes breathing, and then comes circulation. Okay. The order in adults you have to remember is circulation is the first priority. Okay. So why is respiration the first priority? That we'll see in the next slide. Okay. So listen carefully to the next slide. So for a deeper and mandatory understanding of newborn resuscitation, we need to know what happens in the adults. Okay. Most often, an adult cardiac arrest is a complication of CAD, that is coronary artery disease. Okay. It is caused by sudden arrhythmia that prevents the heart from effectively circulating blood to the system. Okay. And as the blood flow to the brain decreases, the adult victim loses consciousness and stops breathing. And at the time of arrest, the adult victim's blood CO2 and blood oxygen content is relatively normal. Okay. And the lungs remain filled with air. And during adult resuscitation, the chest compressions maintain circulation until some form of support, that is either in the form of an electrical defibrillation or medications, restore the heart's function. Okay. That is not the case with the newborn. Okay. And that's what we're going to see. Okay. So listen carefully to the next slides. Hence, this is the reason why CAB is the order for resuscitation in adults. Now we have to know the exact reason why newborns require a different approach than the adults. Okay, why respiration is the priority. Okay, so before birth, fetal respiratory function is performed by the placenta instead of the fetal lungs. Okay, so when the placenta is functioning normally, it means that it transfers oxygenated blood from the mother to the fetus and carries CO2 away from the fetus to the mother. Okay, a healthy fetus makes breathing movements which are important for normal lung growth. Okay, and when placental respiration fails, the fetus receives an insufficient supply of oxygen and carbon dioxide cannot be removed. Okay, so as a result, the acid levels increases in the fetal blood as cells attempt to function without oxygen. Okay, and also because carbon dioxide also accumulates. Okay, and at this point, if we do a non-stress test or an NST, the fetal monitoring may show a decrease in activity, loss of heart rate variability, and heart rate decelerations. Okay, and if the placental respiratory failure persists, the fetus will make a series of reflexive gasps, which can be followed by bradycardia and apnea. And if the fetus is born in the initial phase or early phase of respiratory failure, tactile stimulation may be sufficient to initiate a spontaneous breathing and recovery from the failure. But if the fetus is born in the later phase of respiratory failure, the newborn will require some form of assisted ventilation to recover. Okay, and the most severely affected newborns only, just remember, the most severely affected newborns only may require chest compressions and drugs such as adrenaline. Okay. And at the time of birth, the issue is that you may not know if the baby is in an early respiratory failure or a late respiratory failure. Okay. So there comes the significance of following the neonatal resuscitation protocol, which we will learn in the subsequent slides. Okay. And, and we have to know as for a fact that unlike adults, newborns in contrast, they have a healthy heart. Okay. And when a newborn requires resuscitation, it is usually because respiratory failure interferes with the oxygen and CO2 gas, the exchange. Okay, the exchange. I'm hoping you understood. Okay. And so, once again, to drive home the point, Ventilation of the newborn's lungs is the single most important and effective step in neonatal resuscitation. So we'll be going into fetal circulation next. Okay. This is for knowing what happens during the transition from fetal to neonatal circulation. Okay. Understanding the basic physiology of the cardiorespiratory transition from intrauterine to extrauterine life will help you to understand the steps of the neonatal resuscitation protocol. So this is the fetal circulation diagram. I'll try to make a pointer. This is small, but this is the only thing I have. Okay. So this is this fetal circulation. As you all might be knowing, before birth, the fetal lungs, okay, the part which I'm highlighting or at least trying to highlight, the fetal lungs are filled with fluid and not air, as they do not participate in gas exchange. Okay. So all of the oxygen used by the fetus is supplied from the mother's blood by diffusion across the placenta. Okay. The oxygenated fetal blood leaves the placenta. Okay. The oxygenated fetal blood, the red vessel, the reddishly shaded vessel, as I'm trying to point out, leaves the placenta through the umbilical vein, that is the reddish vessel, and it goes into the right atria. Okay. And the blood vessels in the fetal lungs, okay, that is the pulmonary vessels, they are tightly constricted and very little blood flows into them. Okay. Instead, most of the oxygenated blood returning to the fetus from the placenta via the umbilical vein flows through the foraminoveil. Okay. This yellow arrow that I'm trying to point in, the flows through the foraminoveil or the ductus arteriosus. Okay. This part. Okay. Ductus arteriosus, and as a result, they bypass the lungs. That is, the oxygenated blood bypasses the fetal lungs. Okay. And because blood flows directly from the right side of the heart to the left side without entering the lungs, it is called a right to left shunt condition. Okay. And inside the uterus, this right to left shunt, it actually helps the fetus to have its richly oxygenated blood to flow directly into the fetal brain and fetal heart. Okay. So actually that is a protective mechanism. Okay. Which has to be there for the fetal growth, fetal brain and fetal heart growth, and for proper oxygenation of the fetal system in the intrauterine life. Okay. So after baby's birth, a series of events, they culminate in a successful transition from fetal to neonatal circulation. Okay. As the baby cries and takes deep breaths, fluid is absorbed from the alveoli, okay, or the air sacs, okay, and the lungs fill with air, okay. As you can see from these four alveoli progressively are replaced or absorbed of fluid, and air is gradually filling the alveolar sacs up, okay, okay. So then what happens? Then this happens, okay. There is vasoconstriction. Okay. Initially, the blood vessels or pulmonary vessels are constricted when the alveoli has fluid inside. Okay. Now, after the baby has taken his first few breaths and cries, the vessels dilate. Okay. The vessels dilate and the air can flow into the alveoli where oxygen will be absorbed and carbon dioxide will be removed. Okay. By the process of CO2 and oxygen exchange. Okay. Diffusion, gas exchange happens in the alveoli. Okay. Via this mechanism, the constriction is relieved by the presence and incoming of air. So this is a transitional circulation pathway. Okay. This is not a fully mature newborn circulation there, and this is not a fetal circulation. This is the process that happens in between those two. Okay. The oxygenated blood, okay, this is the baby's lungs that is gradually being filled with normal air. Okay, so the oxygenated blood which now returns from the baby's lungs. Okay, baby's lungs, that is these reddish things. Okay, these reddish parts of the diagram, they fill the baby's heart. They fill the baby's heart and ensure that the heart and brain will receive adequate blood flow once the umbilical cord is clamped. Okay, so what happens when you clamp the cord? Clamping the umbilical cord, increases it increases the baby's systemic blood pressure, decreasing the tendency for blood to bypass the baby's lungs. Okay, okay. I hope you understood. Okay. And although the initial steps of transition occur within a few minutes of birth, the entire process may not be complete for few hours or days. Okay. For example, it may take up to 10 minutes for a healthy newborn or a healthy term newborn to achieve an oxygen saturation of greater than 90%. Okay. But it may take several hours for a fluid in the lungs to be completely absorbed and the complete relaxation of pulmonary blood vessels, which also occurs gradually over several months. Okay. Here the one point that I mentioned right now, it may take several hours for the fluid in the lungs to be completely reabsorbed. Okay. That point will be very valid when we learn a few conditions of respiratory distress in the newborn in the coming portions. Okay. So keep that in mind. Okay.